Antibiotic resistance is a global public health problem. And over the last couple of years, the antibiotics have been misused and inappropriately used a lot. For instance, in the community, around 30 to 50% antibiotic prescriptions are not appropriate, either by the choice of antibiotic, the dose of antibiotics, and the duration of antibiotics. So this is mainly causing the resistance to the bacteria.
And so how will this finger prick test and throat swab potentially address the overuse of antibiotics?
The finger prick test, it actually tells how severe the infection is and how likely it is bacterial. And that piece of clinical information actually help guide a GP and any doctors to make decision whether the patient need antibiotics or not. And the test result comes in 2 to 3 minutes time, which is very feasible in the general practice settings. On the other hand, the swab test actually 100% accurately pick up whether the sore throat infection is caused by group-based Staph bacteria, and that actually really help guide the antibiotic treatment for the patient.
So is this Geelong test part of a bit of a global effort to work out just how effective these tests are?
So the point-of-care therapy testing has been trialed globally, and it has shown that this has enormous impact in terms of reducing antibiotic use in the community. And the result shows that 40 to 60% antibiotics can be reduced by using the point-of-care therapy testing. And the swab testing that I'm using, that is quite novel. It hasn't been trialed globally, but I'm doing this test in Geelong at the moment. But I'll be doing the pilot trial and the bigger randomized control trial in the next stage.
And so do you feel like you're part of something really important here? Because this could be a bit of a revolution in trying to stop the resistance building.
It is. I'm as a researcher really proud of working as an antibiotic steward. So you think, globally, 7 million people are dying around the world because antibiotics are not working. So I feel great if I can help the clinicians to make an optimal decisions of using antibiotics and help patients saving from the harmful effect of misuse of antibiotics, and broadly to help the government to tackle these issues. So absolutely, I'm really happy and to be contributing more in the field in future.
But are there some limitations with these tests in the types of bacteria detected and with challenges with secondary infections?
I think the swab testing is rightly pick up the group-based Staph, so that is very specific and 100% accurately pick up that bacteria. On the other hand, the CRP is not a specific biomarker. It doesn't really tells us which bacteria actually causing infection, but it is an indication that the infection might be bacterial, but the test result could be interpreted with the other clinical assessment by the general practitioner or any doctors for any particular infection. So mostly lower respiratory tract infections, the CRP test result is very useful to avoid antibiotic misuse in pneumonia and other infection as well.
So do you feel like in 10 years' time or so, this could really make a big difference?
I mean, it is. We need the next phase of research is going to be to determine whether these tests are cost effective or not. So if we can prove that this test is cost effective and we can introduce this test at a larger scale in the community and the hospital, and it would have enormous impact to optimize antibiotic use in the routine practice. And this is something that would help establish antimicrobial stewardship programs in the community level, and it increased the awareness among the patient and the general population that I should not use this antibiotic unless I have the bacterial infection. So it would have the breakthrough in addressing the challenges of antibiotic resistance around the world.